Hey everybody, I just wanted to walk you through your complete home care kit. So just a reminder, you may have been prescribed some different instructions than every single patient. So I'm just going to show you how all the equipment works. Just make sure you're checking in with your doctor so you know exactly what you should be doing. So inside your home care kit is going to be a wobble cushion. You're going to do these wobble seat exercises exactly how you do them at the office at home. You want to put this cushion with the spiky side down onto a very sturdy chair with no arms. So a folding chair works great. A kitchen chair is ideal as well. If you don't have a sturdy chair, you can always use your toilet seat. It's got a nice firm seat on there. That would work just fine. You're going to do the wobble seat exercises 3 times a day at home. In the initial phase of your care, the goal is to do that twice a day. The second part of your home care kit is going to be the cervical traction unit. So again, this is just like the traction unit that's at the office, but it's set up for home use. This is a weight. You're going to hang the traction unit over your door. The weight is going to be on the opposite side of the door from you, and then you're going to shut the door. You always want to be standing on the side where the hinges are, so that way you're pulling the door into the frame. The first time you use the traction unit, you're going to loosen this knot. It's just a regular slip knot, and you're going to raise it up to your height. So just to remind you, the perfect height for you is when the traction unit is resting comfortably just below your chin when you start. Make sure that you're not pulling it up like this to find that height. The 2 units should be together and it'll be just below your chin. Then you're going to hang this over the door, retie the knot, and then it should stay like that so it's the perfect height for you. I always remind patients that the first time you use this unit is brand new. The rope is going to stretch slightly, so tie it a little bit higher than you think, so that way you have it at a good height for you as it stretches out just a little bit. The goal with the traction unit is to keep working your way up systematically to 60 repetitions. Again, sometimes you may not be able to make it to that amount, but the goal is to get there eventually. So 60 repetitions, and again, in the first phase of your care, you're going to be trying to do this twice a day. If you need help setting up the traction unit, inside your bag is going to be these instructions, and it reminds you how to get the traction unit set up. You can always message us or give us a call if you have any questions or concerns. The last piece of your traction unit is going to be your spinal molding rolls. There's 2 rolls. There's a large roll and then there's a soft roll. You can see the diameter of them is bigger and then smaller. And these are little pillowcases for them. Don't wash the rolls. You can pull these pillowcases off. You can wash those. The large roll is for your neck. What you're gonna do is you're gonna lay flat on your back on the carpet or your bed. You can bend your knees up so that way you are more comfortable. The large roll will go right at that bump you feel at the base of your neck, and then you'll lay back onto it. The small roll goes in the small of your back. That's how I remember that. Small roll for the small of your back. What you're gonna do with the small roll is it goes below your rib cage but above your hips. So for female patients, that's gonna be a little bit of a small margin of error there. So again, it's below your ribs but above your hips. You do not want it down here where those 2 little dimples are. That's too low. It needs to be up here above your pelvis so it is sitting on your spine. And again, your goal is to lay flat on your back, starting with 5 minutes, and then work your way up to being more comfortable on the rolls till 20 and 30 minutes. If you are sore, stiff, or any of those things after you get off the roll, that means you've done it for a little bit too long and you want to scale back or to only add a little bit of time. The goal is eventually, once you feel comfortable at 20 to 30 minutes, that you can lay on them in bed as you're falling asleep and they become your new pillows. So I hope you enjoy this video about the home care kit. If you have any questions, don't hesitate to reach out. You can message us or you can call the office. Bye.